Welcome to Frontline Nursing, a nurse-minded production that gives you an insider's look into the daily life of nursing from those who are currently working on the front lines. Whether you're considering nursing as a profession, you're currently a student, or you're a nurse in transition, this show will give you some behind-the-scenes information to help you guide your career. My name is Tammy Dunnett, and I'm your host. On today's show, we are joined by Zoey Froemgen. She's been an LPN since 2017. Welcome to the show, Zoey.
Thanks for having me.
I'm actually really excited to catch up with you because you've been through a little bit of transition lately.
Yeah.
Before we get into that move, I want to just kind of step back and get a sense as to why nursing. How did you find nursing to be your occupation? What brought you to it?
So when I graduated high school, we moved to Fort McMurray, and I did a couple years. I thought I was going to be a therapist. When I first graduated, I was going to school, majoring in psychology, but I was just out of high school and I was not ready to go to school. So I partied a lot and just kind of wasted my time. So after that, we moved to Edmonton. I still wasn't really sure what I was going to do. I knew I wanted to do sort of person-centered focus kind of a career, something around people, helping people. I knew that for sure. So I went to do my emergency medical responder.
Okay, EMR.
Yeah. So I was gonna be a paramedic. I was like, yep, I'm gonna be a paramedic. So I did that course. I worked up in the oil rigs for a bit. Wasn't really for me. It was really boring. And I knew that I probably could not handle all the stress and the trauma that came with the job.
When stuff did happen.
I knew my mental and physical limitations at that point. So I applied for nursing just for fun to see if I could get in. I got in and I was like, I won't actually go to school. So I took another year off. I'd worked in admin for my whole life, pretty much, working in an office setting. Took a little time, worked in traffic. I know a lot of weird skills that I'm never going to use. I can block a road really well.
You never know when that's going to come in handy, so.
Yeah. So then I decided that I should probably be serious and take a step forward. So I applied for the LPN program again. I didn't even try to apply for the RN program because I knew my grades were not good enough. I didn't get in because I was lacking the math. So I had to upgrade my math. So I did the nursing math that NorQuest offers. And then I got in.
So even though you applied initially a year before on a whim, thinking I'm not going to school, the next year you kind of felt committed because you actually took the course that you needed to get in that kind of delayed your admission.
Yeah, exactly. So I was applying to go in the fall and then I didn't get in. So I did the math and then I got in the winter.
Okay. What happened in that year where you kind of thought, okay, maybe I'm ready now, because you had the acceptance the year before, decided you weren't ready. So what happened in that year that made you go, I'm going to adult now and I'm going?
I was tired of doing jobs that I hated.
Okay.
I just did admin because I was good at it, I guess. Like it was boring. It's just, I went from job to job because, it wasn't, they could probably tell that I didn't want to be there. And it's just, it wasn't for me.
Yeah, so it wasn't challenging enough.
Yeah, well, some of the jobs were challenging, but just not in a way that I guess nursing is. Like it.
True.
Like just sitting at a desk and like trying to figure out all this paperwork wasn't really for me.
Yeah, that's very interesting. So you mentioned earlier that the EMR thing, you said you recognize your physical and mental limitations.
Yeah.
EMR is different than nursing. So I'm kind of wondering if EMR kind of made you think I'm not ready for this, how did nursing become the fallback at that point?
So at that point, I hadn't yet been diagnosed with my physical disability, but I was still physically limited at that point. I knew there wasn't something right. So I went into it, and I struggled. Like I struggled a lot with like patient lifting and like being on my knees all the time. So I knew that nursing was still hard and you had to be on your feet, but maybe like a little less.
Oh, okay.
I wasn't sure, honestly. Like it was still kind of up in the air.
Yeah, it's just another patient-centered or a caring profession that
Yeah,
comes through.
exactly. Yeah.
Yeah. Okay, so you kind of alluded to the diagnosis,
Yeah.
fibromyalgia.
Yeah.
When were you diagnosed with that?
So I was diagnosed in 2017, halfway through my preceptorship.
Okay.
I had gotten in a pretty bad car wreck, totaled my car, and I ended up having to miss a day or two of my preceptorship just doing my
Understandable.
car and stuff. So about a week or two later, I went to the doctor and he sort of, I guess, diagnosed me then with my like past medical history and stuff. So we're not really sure if the accident caused it or if it just kind of aggravated it.
Sure. Did it make sense for you when you had that diagnosis? Did the stuff in the past, like how you were mentioning the physicality of EMR and those pieces, that kind of fall into place for you then, going, okay, this makes sense, I now understand it?
It was really nice to have a diagnosis because a lot of the times people that have fibromyalgia, it's kind of their last, it's like the last thing that doctors turn to.
That's
So
right.
they do tests, they do MRIs, they do x-rays, they do blood work, just to kind of rule out anything else. It's a last resort diagnosis, basically.
Mhm. Is it an umbrella term? Do they consider it an umbrella? Because it kind of captures a lot of different symptoms that.
Yeah, for sure. So a lot of people think that it's just pain, but it's chronic pain, fatigue, bowel problems, light sensitivity, sound sensitivity. Like it's a lot of different things that people don't really know about, I guess.
I would agree because you just shared some new things with me. I didn't know about the light sensitivity and the sound sensitivities either. So,
Like anxiety, depression, just a lot of I could name so many symptoms, but
and I think that's great that you are sharing because there might be someone listening going, gosh, I was having troubles too, and maybe this is what I need to know about. So feel free to expand on it as you are comfortable.
yeah, for sure. Yeah. So it was nice to sort of, we're still like it's hard to I guess what's the word I'm looking for, like accept the diagnosis because you're like, are you like, because they can't really be sure. It's just process of elimination. So they're saying, well, we don't really know what's wrong with you, so it could be this.
Right. So on one hand, it's nice to have an idea and maybe a treatment plan or some strategies to deal with the symptoms that you live with. But on the other hand, you're thinking, could there be another treatment? Or could there be
Exactly.
something else that will just get rid of all of this? So you're always wondering.
Exactly.
Mhm.
It's the chronic thing, right? It's the I'm always going to have this.
Yeah. So what does that do to your mindset?
It's hard. You have to sort of push yourself a lot because you have this mindset, well, you have this disability, and it limits you a lot in what you can do.
Mhm.
Um, but sometimes you just need to push through that and like test your abilities, and see how far you can go without, you know, doing too much. And that's hard. It's a hard balance.
Sure. And I would think it's hard because people on the outside can't see. They don't know the struggle
Exactly.
you're having because it's a lot of mental mindset and pushing forward through things.
And it's not that they don't believe you, but it's hard for people to, I guess, accept what you're saying to them. They're like, well, I get tired too. Well, my tired is not the same as your tired.
Yeah.
So,
Yeah, you're right. They don't have a frame of reference to make a connection to, which is what makes it really difficult for people. When you see a cast on an arm, we often compare
Exactly. If I had diabetes, or if I broke my leg, or if I had something tangible that people could actually physically see, it would be a lot easier, I think.
That's right. Yeah, but you're not going around testing. You're not doing finger pokes every day. Like somebody
Exactly.
has to do insulin testing, so people don't see those processes
Hmm.
internal. How has this impacted the way you nurse in terms of your empathy and understanding of other patients going through similar issues or different issues?
Sure. So I have to know my limitations when I'm on the job. I love to be a team player. I love to help out my HCAs. I have a great group of HCAs that I worked with. But at the same time, like, I can't help them do transfers. I can't help do a lot of things that I wish I could do.
Mhm.
So I just tried to do as much as I could, to sort of help out and do as much as I can.
Mhm.
So, we do medications and stuff, but if they need help doing a transfer or rolling someone, I have to take a step back and say, hey, sorry, I can't help you, but we'll find someone else who can.
And is it because in that moment you feel a limitation, or if you were to help them, it would aggravate another problem and you'd be off for a little while, or how does that?
Exactly. So I have to realize that if I'm going to help out, I might not be able to come into work the next day because it's really aggravated something.
It has a significant impact to you,
Yeah,
not just your job, but your quality of life then.
exactly. So I have to consider my quality of life versus everyone else's.
Yeah, well, I mean, there are considerations that we all make. I mean, I go to the bedside too, and I look at the patient and I'm looking at the number of people and I assess whether or not it's a safe thing or if I'm capable of doing it. I just don't have that extra layer to consider, but how is this going to impact me tomorrow? I should be thinking about it even with and without an additional diagnosis of fibromyalgia. Because how many times have you probably as well gone into a room and done something and the next day you wake up, you're like, oh, my back's a little sore.
Yeah, I have pushed myself too much a few times. I felt bad. We are always short staffed. If you've ever worked in long-term care, you're always short staffed. So sometimes you don't have a choice and you have to help out and kind of pay for it the next day.
Yeah, unfortunately. How
Yeah.
about the patient side? So this was 2017, end of your clinical. Has this changed how you nurse patients at all? How you engage with them,
Um,
advocate or anything?
I don't think so. Well, it's hard to say. I still have a lot of, working with the elderly, I think gives me a lot of empathy. Just yeah, I don't actually know if my diagnosis has changed the way I would work with people, to be honest. I guess when I see patients that have, or residents that have, like, maybe like a chronic pain disorder, I look at it a little differently, but it doesn't really change that much, I find.
Mhm, mhm. Do you find in the workplace, so I've often experienced this myself, so acute pain and chronic pain are treated and managed very differently.
Yeah.
And for those who haven't experienced it or haven't had to work with it before, they really struggle with the idea of dosing a chronic pain because they think it's too much too often. And the measurements aren't quite the same, right? They can still be a 3 out of 10 and still need that medication.
Hmm.
It's chronic. Do you find that you're able to advocate and educate a little bit more around that with people in your workplace who are struggling?
um I've never worked in a hospital setting, so I'm not sure what the deal is there. But I do know in long-term care, we treat all pain kind of the same. There are a lot of residents that have, regular dose of Tylenol that they take like 4,000 milligrams a day, like 4 grams a day of
Mhm.
Tylenol. And then we have residents who don't get regular pain medication, but we sort of do the same dosing for everyone, whether or not they're on regular doses of pain medication. Obviously, if they're on a regular dose, we can't give them extra.
Right, it's kind of prophylactic in some ways, and yet
Yeah,
there's this expectation that everyone who's a senior's got aches and pains somewhere.
exactly. But we don't, so we don't treat pain, like, we treat the pain based on what they're telling us and what we're seeing, like in their facial expressions if they can't speak and stuff.
Right. Yeah.
So, and then some people get different kinds of pain management. It all depends on the resident and their diagnosis and what they've expressed.
Mhm. So when you were, I want to go back to the diagnosis and the fact that you're almost done nursing. What were your immediate thoughts about how this would impact your career when you found out that this is what the doctors think you're dealing with? Were you worried at all about continuing on in nursing or?
Oh, for sure. Yeah. Um, like I probably can never work in a hospital setting. It's too much
Mhm.
for me. Um, I can do 12-hour shifts, not well, but I can push through it. I have to know my limitations, so I know that there's certain places where I probably can never work. Um, but working in a hospital has never really been an interest to me.
Mhm.
Um, I'm more interested in getting into mental health and addictions. So it was hard, but at the same time, it was okay because I knew that wasn't really something that I wanted to do.
Mhm. Did you have to go through any? I think a lot of times when a patient gets diagnosis, there's the relief and then there's kind of a mourning
Yes.
of what could have been. Did you go through that mourning as well, or?
Yeah, I did. At least I think I did.
Yeah,
I was
that's okay.
relieved. But at the same time, it's like you don't want to do something, but at the same time someone's telling you you can't do it and you're like, "Oh, well, what if I
And you
want
want to do it, right?
to?" Yeah.
Totally understand that.
Yeah, so they're kind of taking that choice away from you.
Right, and I agree. I don't like that either. I'm currently rehabbing a shoulder, and it's been 6 months of chronic burning, but it's been 6 months of telling myself that I have something wrong, and I don't know what it is, and I don't know how to proceed, and I have limited everything. And I was kind of thinking about that as you were sharing your journey about fibromyalgia. But that's all internal. Nobody sees it. I push
Yeah.
through a lot. Nobody knows because it's similar, right? You just have to do things, right?
Hmm.
I forgot to ask you about your, you talked a little bit about how you manage it and work with it. It's not who you are, it's just a piece of who you are. It's types of patient population that you choose not to work with because it's too physically or emotionally demanding and it will trigger things. You talked about being able to do 12s, but not very well. What other strategies, like, so for those who are listening who might be wondering that this is their diagnosis or this is something they should be considering, what other tips or strategies can you share with them to help them still be productive? Because obviously people with fibromyalgia are still employable. They're not all at home
Absolutely.
hiding out. But there are ways that they have learned to manage and cope with.
For sure. Everyone is different. Everyone's diagnosis and symptoms are completely different. I know people that are completely disabled who can barely walk, who can't work. They're
Mhm.
on disability. I am lucky that I can work.
Yeah.
Um, like I'm very lucky. So I think it depends on where you're at with your diagnosis and where you're at with your symptoms. If you're like me or even less pain than I am, definitely just kind of do what your physical abilities, I guess, are. Obviously, if you're more disabled and you can't work, then don't push yourself too hard. But it's really hard for me to offer any advice because everyone's different. And it's hard
Mhm.
for me to advocate for everyone because some people can't do what I do, and some people can do a lot more than I can do.
Yeah, fair enough.
So it's really just knowing where you're at, and knowing your limitations.
Mhm. Are there self-care activities that you do that help you stay healthy? I'm thinking of the traditional things we would say to somebody who maybe has cardiovascular disease. So diet and exercise and sleep and hydration and those kind of things. Is that, you're kind of smiling. I'm like, yeah, you probably heard that before too. Is that a part of it?
I get a lot of opinions from a lot of different people about what I should be doing. I get a
Yeah,
lot of people saying, "Oh, you should meditate, you should do yoga, you should do
yeah.
this, you should do that. It will cure you, it will make your life so much better." You know what? I try I am trying to work out more. I'm trying to find, I guess, a path because every time I go to work out, I end up doing too much. And I think I can do a lot more than I can. So it's just trying to find the balance. I probably don't drink enough water. I know I don't exercise enough. I eat right. I also medicate with cannabis, right? So when I'm not working, if I'm having a bad day, I use medical marijuana. I know it's legal in Canada, so I can talk about it.
Yeah.
And I do things like I play my guitar. I just kind of do things at home, like rest and relax. I've actually been off for a month. When we moved here, I was planning just to take Christmas off, just to be with family and to just rest, but ended up taking a little more than that.
That's all right.
But I'm getting kind of bored, so I'm ready to go back to work.
Yeah. It happens. So what's been the most challenging part for you? With the move, with finding a job, with navigating the stuff you deal with?
For me, I think it's finding a balance between working too much, finding ways to, I guess, relieve my pain, like work home life. It's hard because sometimes like I feel like I miss out on a lot of things. Like we went for bowling. We went to go bowling a few weekends ago, and I really hurt myself because I thought I could do it, but I guess I can't bowl.
It doesn't really impact you, or maybe it does in the moment. Is it like something that kind of creeps up after hours?
Oh, well, it does sometimes. I could tell right away that it was not going to be good. But I did it anyway because I don't want to miss out on doing things, right? It gets hard. Yeah. I guess it's that, I don't want to say this because it sounds awful, but that FOMO, fear of missing out kind of thing, really gets to you. Because you're like, I want to do this thing, but I know it's going to be hard and it's going to hurt after, but I also want to do it because I don't want to miss out on things.
Do you worry that in not participating, that relationships will suffer, or that you'll be less likely to be invited and hang out with people? Or is there that connection piece that you're worried about more?
For sure. I don't have any friends here yet. It's hard to make friends when you're an adult.
It can be, hence why bowling would be great, right? There's so many advantages to just going out and partaking in something like
that. So I definitely worry. I feel really bad when I'm not feeling good. My boyfriend wants to go out and do something, and I'm like, I can't. And I feel bad, and sometimes I do it anyway, but I feel kind of crappy. So we try to do things sometimes that aren't physical, like we go to trivia nights and we try and do other things that aren't super physical, but I do feel bad because I know that I'm sometimes holding people back with my physical limitations, and that doesn't make me feel good.
It's funny, as you were saying that, that's what I was thinking you were feeling.
Yeah.
If you didn't go out, you'd be holding them back. And
yeah, it doesn't feel good. But then I have to remember also that it's not my fault, and that it's just kind of a part of my life, and that people wouldn't be in my life if they didn't support me. So, But that's hard. It's definitely hard to think about in the moment. You feel really bad, and then a few days later, you're like, oh, well, okay.
And I wonder if there's also an element of, so let's just say you got the offer to go bowling and you're like hesitant, you think, I don't think I can handle this, I'm going to say no. And then you stay home and the rest of the night progresses and you still feel the same because you didn't go do the physical activity, but you're feeling like by the end of the night, well, maybe I could have. Do you have any of that?
Yeah, exactly. I feel that all the time. I'll feel really bad in the beginning of the night. And then as the night goes on, I'm like, well, maybe I could have done that. But then I'm like, well, it's too late now. And I kind of feel bad, but at the same time I'm like, well, what if I went and it didn't go so well? It's hard. It's really hard knowing whether or not it's going to affect you.
It does sound like that's probably one of the bigger side effects, if I can use that word, of fibromyalgia, is that guessing and wondering and kind of navigating relationships and still trying to be a part of society and yet still protect yourself so you can be a part of society long term.
Yeah, it's definitely the hardest part. I'm still figuring it out. This is still fairly a new thing for me.
Yeah.
So I don't have all the answers. I don't know everything. I'm still trying to figure out my body and like what it's telling me and stuff and what I can and can't do.
Mm-hmm. Okay, let's shift gears back to that long-term care nursing.
Sure.
Tell me like some of the best things, like, you've been doing this for a little while now, and this population, the geriatric population, can really start to pull at your heart because you see them every day. They become like family.
They are like family. I love my residents. I miss them. I miss, because I had to quit my other job in Penticton because I wasn't going to commute. It's too far. I miss my residents. They're great. You get so emotionally, and it's hard not to. Some of them you're kind of less involved with because you have your people that you like and some people that you don't like so much. But yeah, it's not like the hospital. Like you don't like these people are there. That's their home, and you're in their home.
That's a really, I think that's an important perspective for people to remember. I do think long-term care nurses sometimes get looked at differently when there's people who work acute care, medicine, surgery, and there's a difference in the nursing. There's an importance in the nursing in both areas. But I think there's a comparison sometimes among nurses, which is unfair because you are in their home. Like this is an important position you hold. You are invited essentially
Yeah.
to come into my house and be a part of my family. And so that's a really important role.
Yeah. So we do patient or resident, we don't say patient,
Yes.
resident centered care, which basically means that we involve them in every part of their care.
Mm-hmm.
So their care plans, their medications, like the way they're being treated, like everything. They are a part of everything. We have yearly care conferences that they are invited to. Mm-hmm. They don't have to come, but a family member comes and sort of advocates for them. But all of our care is focused around them. So how would this affect them? Not, I guess, like we're just going to do this because you need it, but it's, yeah.
Now, you remember when you were in school, you thought long-term care was not the place for you. And there's a lot of nursing students who will be listening to this. So this is your chance now to really promote the benefits of being a long-term care nurse, because I do think it's overshadowed by the, I'm quoting, the glory of being the med-surg nurse and getting the skills and the talent.
Yeah, so I'm not going to lie. You don't, like this may scare off people, but you don't get the skills that you get in med-surg. Like I have used barely any of my skills that I learned in school. Like the wounds and stuff. You use a lot of like critical thinking skills. Like you use a lot of skills that you don't really think about that you learned, like critical thinking, care planning, just thinking about the person as a whole. It's also a lot of people think it's easy and it's boring. It is not easy. It is not boring. Mm-hmm. It is a challenge. You are looking after at least 30 people. You're responsible for 30 people at least. And at least that's what my facility was. We had 30 people upstairs, 30 people downstairs, and we had sort of dementia locked cottages on the other side of the facility that had 40 people. So if you're working nights, you're responsible for 100 people.
Yeah.
And things can go bad very fast. So I guess my advice is to I guess treat it like it's hard because it's not med-surg. It's I don't know if it's harder because I've never worked med-surg, but I do know it's a lot harder than people think it is.
Yeah, but it's also more rewarding than people think it is. I think that's the part that they miss out on, is that the rewards are absolutely there. So, I mean, I always tell people just in terms of leadership skills.
Yep. So I am responsible for 3 or 4 care aides. I'm a team lead, basically. There's the RNs, but you don't see them on the floor. They're usually in their offices doing paperwork. Sometimes they're on the floor if there's like something, because in BC, LPNs aren't allowed to look after unstable patients by themselves. There has to be an RN present. So they're around if something's going wrong, if someone's, it's hard, like
But they rely on your judgment to know when to bring them in.
Exactly. So we're kind of in charge of the floor. We come to them if there's something up, like we have to trust our judgment on whether or not we need an RN or if we can do it by ourselves.
Yeah. Okay, so for someone who's maybe, what do I do? How do I find my fit in nursing? Do you have any advice for them as to, because I know particularly in NorQuest, this program is 2 years, you get 3 placements and you're out there trying to figure life out. So,
don't do what I did. Don't go into a rural hospital. You don't get a good sense of what med-surg is in a rural. I went to the Fort Saskatchewan Hospital. It was a great hospital. But we had no surgery. We basically did 4 weeks of medicine. And then.
Is that your final preceptor?
Nope, that was my med-surg clinic.
Okay.
I asked if I could be placed in a rural hospital because I was told that sometimes you see a lot of everything.
That's true.
Not that one though, turns out. We did 1 or 2 days in day surgery, and that was kind of cool. That's where we got to do our 2 days of IV starts. I only got to do 1 IV start my whole clinical, so I've only ever done 1 IV start.
We all start somewhere.
And so
when I finished my 4 years of nursing, I had never had a total care patient in my 4 years of nursing.
Wow.
When I got on the floor and I'm working as a nurse and I have to do a total bed bath and dress somebody, I was lost. I'm like asking the nurses, so how do I put their clothes over their head? How do I get their arms in? Is there a tactic? And they're looking at me like I'm from another planet. I'm like, I've never been assigned someone who's needed this. So
that's the thing in long-term care is you don't do that. That's sort of the HCA job. They do the dressing and the care. We do the meds and the assessments and stuff. Obviously, we chip in if we're short-staffed. We'll help get people up. But that's not our regular job. So I'm not sure if that's what they do in a hospital, but that's not how it works in long-term care.
Yeah, no, I just shared it more as an example of how, you said you only have the 1 IV start, and I'm like, I'd never taken care of a patient with big dress. So like there's so many skills we come out of school with thinking we're going to get it, and we're like, nope, you're not going to get it all.
Oh, it's funny because one of the days we were very short-staffed and I had to help with patient or resident care, and I had to ask for an HCA to come help me because I'm like, I don't know what to do because I've never done this before. And they look at me like I have 3 heads. They're like, well, you're the nurse. You should know.
That's when you would tell them, I haven't done it and you're the expert, and I would much rather learn from somebody.
Exactly. I think a lot of people take advantage of their HCAs and how much they know. They are the backbone of healthcare, let me tell you.
Yeah, absolutely.
Thank you so much. I would not be able to do my job without them.
I agree. I'd like to take this time to thank Zoey for sharing her insights and her experiences in living with fibromyalgia and working as a nurse. Now, if you'd like to become a member of the Frontline Nursing crew, go on over to frontlinenursingpodcast.com. Become a member today where you can get access to the video recordings, behind the scenes conversations, and a free download just for you. If you'd like to be featured on the Frontline Nursing podcast, send me an email at info@tammydunnett.com and use the subject line Frontline Nursing.